Good morning. Today we discuss General Club is a hematological cancer among patients with type 2 diabetes prescribed GLP receptor agonist. This paper published in last month, 6 March 2025 in JAMA Open Network. This is the Journal of American Medical Association Journal. So introduction part is, as we know, type 2 diabetes and obesity have been identified as a independent risk factor for various cancer, including hematological cancer. Glucagon-like peptide receptor 1 agonists have emerged an effective treatment offering glycemic control, weight reduction, and immune modulation, and are also associated with lower cancer risk, especially solid tumors. But in this study, aim to compare the risk of hematological cancer in patients with type 2 diabetes treating with GLP-1 receptor agonist compared with metformin and insulin. As we know, we are generally use in our patient metformin, insulin, and glimepiride medicine. But as we once we see this topic, hematological cancer among patients with type 2 diabetes, प्रिस्क्राइब जीएलपी रिसेप्टर एगोनिस्ट. जब इस टॉपिक को पहले पढ़ते तो ऐसा लगता है कि जीएलपी रिसेप्टर देने से शायद हेमाटोलॉजिकल कैंसर का एसोसिएशन बढ़ जाता है, बट इन द डिस्कशन पार्ट इट रिप्रेजेंट द डिफरेंट कि व्हेन वी यूज द जीएलपी एगोनिस्ट द हेमाटोलॉजिकल कैंसर associated then metformin or insulin is decreased. So a brief about the GLP agonist. They are falling into two broad categories: human GLP backbone agent and Exidin 4 backbone agent. So generally, yesterday I discussed with Rajiv sir. He also used semaglutide. The brand name is Ozempic, and the recent molecule is encountered is tirzepatide. It is an injectable form. Name is Monjaro. So Exendin 4 back. This molecule Monjaro is a both GLP-1 and GIP receptor activate. So method of this study is more important than the discussion part and result part. So this is a retrospective cohort study was conducted using TriNextX. This is a repository of the aggregated electronic health record data of medical encountered for approximately 1/4 of the US population. The platform include patient information from various age group, racial, ethnic background, income level, insurance type. The data reviewed are a secondary analysis of existing data, because in this network data already is there. So they do not involve the intervention or interaction with human participant. So what is a TriNet X? It is the broadest federated network of global real world data and evidence for life science and healthcare. So patient with type 2 diabetes prescribed GLP receptor 1 agonist, insulin or metformin between the April 13, 2005 and October 23 were identified. In the study population, they exclude, later I will describe the algorithm, prescribed any anti-diabetic medication before type 2 diabetes diagnosis of identified drug naive patient and those with prior diagnosis of the hematological cancer. And the prescribed medication is, as we discussed, GLP receptor agonist is in the experimental arm, and additionally patient prescribed exclusively insulin or metformin were identified. So this is the study flow diagram. So there is a two analysis were performed. One comparing patient taking only GLP-1 receptor agonist with those taking only metformin, and other comparing with those who only taking insulin. So total number of diabetes type 2 who are on the anti-diabetic agent around 25 lakhs. So among them, after excluding if the patient age is less than 18 year and the diagnosis before 2005 or after 2023, patient with prior anti-diabetic medication or patient with prior history of hematological malignancy. So eligible patient with type 2 diabetes on insulin, GLP or metformin is around 16 lakhs. So the patient prescribed only insulin 9.3 lakhs, patient prescribed only GLP-1 receptor agonist 51,000, and patient prescribed only metformin is 6.1 million, 6.1 lakh. So between cohort and between the insulin or metformin arm, there is a 1:1 propensity matching. So incidence of malignancy in N is 47,000, means what is the propensity matching? So in the propensity matching score, each individual in a treatment group is paired with a single individual from the control group who have similar propensity score. This method aims to reduce the bias by creating matched pairs that are similar as possible in the term of their baseline characteristics. Once we see the table, so we will see that there is a almost equal n number, control arm and cohort arm. The primary outcome was first diagnosis of hematological cancer within 15 years of index evident anti-diabetic agent prescription. The using the inbuilt advanced analytic form, hazard ratio with 95% confidence interval and cumulative incidence were estimated using Cox proportional hazard and Kaplan-Meier survival analysis with censoring applied. Significant tests were two-sided and paired, and statistical significance were set as p-value is less than 0.05. So this is the E table which represent code for demographic, because these all the data already in the some network which already prescribed. So this is the data. I will in the supplement form. So this is the code, female, male, and various parameters are there. This is the code, disease specific, demographic, and data step present or absent. Because when we electronic data, there is a either this is present or either this is absent. So this is the huge data. So in the one limitation in this study is because there is only code specific, because sometimes disease is there and we will not identify the code. So there is a lacunae of this study. So after this, the patient characteristic and covariance after propensity matching of GLP-1 receptor and metformin and along with the insulin group. So this is a huge table. So there is a two different cohort. Cohort 1 is GLP-1, which is n number is 50,000, and cohort 2 is only metformin. The n number is 50,000, almost equal n number. So A's, just we discuss few parameters. One is only GLP-1, two is metformin related n number. So number of patient 55.9% and 55.6%. So there is a standardized difference. It means if the value is less than 0.1%, means there is no significant difference in the cohort population and the group population. So as we see, male and female in one cohort 15,583, and in the metformin group 15,515. So almost equal n number. So this is the propensity score, cohort population and the study two different population, metformin and insulin. So these are the various demographic, male, female, and various race, ethnicity, which in the electronic data. So Asian, Black, Hispanic, because this is a US based population study. And diagnosis, because GLP, as we know, insulin, metformin is only reducing the blood sugar level, but GLP receptor agonist, it also used in the to decrease the obesity. So this is the one of the important indication for the GLP receptor agonist. So overweight and obesity, severe obesity, body mass index. There are three different parameters according to body mass index. And there is a family history of, this is a characteristic of the study population. family history of other malignancy neoplasm of the lymphoid, hematological and related issue. Only 73 and 71 cases have some family history. There is a genetic susceptibility to the malignant neoplasm. Only 159 or 133 study population has some genetic susceptibility for the malignancy. And procedure means radiation exposure either in the form of chest x-ray or in form of the other radiation modalities. Medications, cytotoxic agent, as for the we know this is a chemotherapy agent, only receive 100 around 100 patient. Sulfonylurea, alpha glucoside inhibitors, these are the some agent which have medication which have propensity to the, reflected to the secondary malignancy. Suppose that we are using etoposide in the early age group. So it after a few years later, 1 or 2 decades, it reflect the hematological malignancy or like a AML like malignancy. And HbA1c level. After this is a cohort related to the metformin and other cohort related to the insulin. Same population is there. This is a huge data. So I will shift to my presentation. So after this collaboration of or result of this study is we identified around 16 lakh patient after excluding from 25 lakh patient. The mean age is 62 year, and among them 77.5 lakh is female with type 2 diabetes, of whom 51,000 receive exclusively GLP receptor agonist, and 6.1 lakh receive metformin, and 9.3 lakh receive insulin as per table 1. I will already show this. So the standard deviation of GLP receptor prescription was 485 days. So as we know, there is some confusion between mean, mode or median. So in statistics, the mean is the average of the database. What is the average? And median is the middle value of that database, and mode is the most frequent number of the ordered value. Okay. So after matching, there was 47,000 patient in GLP receptor insulin analysis, and around 50,000 patient in GLP-1 receptor agonist along with a metformin analysis. So compared with insulin, GLP receptor 1 agonist use associated with significantly lower risk of myeloid leukemias, lymphoid leukemias, NHL, MDS, MPN, and monoclonal gammopathies like multiple myeloma and amyloidosis. Across all the hematological cancer was associated with 54% lower risk compared with the insulin. So this is the table. As we know, the hazard ratio for myeloid MDS and myelodysplastic syndrome is 0.1, less than 1, 0.6 and 0.7. Means if GLP receptor versus metformin, the MDS and myeloproliferative neoplasm, there is a decreased incidence of these malignancy. And along with the insulin, there is a hazard ratio for this. This is the almost all the myeloid neoplasm, lymphoid, NHL, MDS, myeloproliferative neoplasm there is a less hazard ratio. So discussion for this study is the finding of these cohort studies suggests that GLP receptor are associated with a reduced risk of developing several hematological cancer, as we discussed, particularly MDS, MPN in patients with type 2 diabetes. This reduction in risk may be mediated by weight loss, immune modulatory properties of the GLP receptor agonist, or both. These associations appear to be independent of glycemic control, potentially through the reduction of pro-inflammatory cytokines implicated in the hematopoiesis dysregulation and the development of the MDS or MPN. Metformin is suggested to have potential cancer protective effective, which could account for the equivocal finding for non-MDS, non-MPS cases in our analysis. Nonetheless, our analysis suggests that GLP-1 receptor represent a promising novel strategy for reducing the cancer risk. It means for reducing the cancer, we directly not give the these agent. The study of this limitations include reliance on encountered code, residual confounding by indications, limited adjustment for multiple testing, and sensitivity analysis, lack of age stratification, and dose responsive relationship. Furthermore, prospective study was needed to explore the biological pathway of GLP receptor agonist in cancer prevention.